Hi there, my name is Scott Suko. I'm the Executive Director of the Liver Coalition of San Diego, and we're excited today to be participating in International NASH Day. Local partners from La Maestra centers and global partners, our national partners from Global Liver Institute. And so thank you for being part of today's educational and screening event. And with that, I'd like to introduce our partner from GLI. Hey, Jeff, how are you doing today?
Good morning, Scott. How are you? Welcome to International NASH Day 2022, which is brought to you by the Global Liver Institute. I'm Jeff McIntyre, the Director of NASH Programs for the Global Liver, and I'm thrilled to welcome you to taking the first steps towards a healthier life for you and your liver. The Global Liver Institute is the world's largest liver patient organization, with International NASH Day being the annual day of awareness, education, and screening for fatty liver disease and its more advanced form, NASH, which is short for non-alcoholic steatohepatitis. Now, roughly 1 in 4 people have some form of fatty liver disease, with 1 in 4 of those having advanced to NASH. While there are no approved medical therapies for this disease, there are steps you can take now to help prevent the worst outcomes, which include cirrhosis, liver cancer, transplant, and in some instances, death. Since fatty liver disease does not usually present symptoms or early signs that something is wrong with your liver, you are taking an important first step today in learning more about this chronic disease and how to have a healthier liver. While 1 in 4 do have some form of fatty liver disease, if you are Hispanic, you are at higher risk. If you are diabetic or pre-diabetic, you are at higher risk. If you struggle with obesity, you are at higher risk. On this International NASH Day, the Global Liver Institute is really proud to partner with the Liver Coalition of San Diego, La Maestra Community Health Centers, the Asian Pacific Health Foundation, and LabCorp to provide a liver screening event on Thursday, June 9th at La Maestra with educational materials available in both English and Spanish. Our educational materials such as, am I at risk for NASH? What happens when diagnosed with NASH? A pocket card with questions about your liver to ask your doctor, and even information about clinical trials can help you be better informed, more empowered, and take control of your liver health. You will be able to learn more through this webinar and through educational materials in up to 16 languages at globalliver.org. Thank you for participating in International NASH Day and for taking this important step towards a healthy liver. I'd like to now introduce Dr. Robert Gish, a consultant at La Maestra and a medical advisory board member at the Liver Coalition of San Diego, and comes with many other credentials, which you'll see in his opening slide. Dr. Gish, off to you.
Jeff, thank you so much helping us celebrate and educate on this very important day. And this is a day to lead us forward into the near and far future of better health. Scott, thank you also for your kind introduction. I'm here to talk about fatty liver. It has other names. You've already heard Jeff use the word NASH or NAFLD, and I want to introduce a new word, MAFLD, metabolic associated fatty liver disease, which I believe is the best term for this disorder. And we'll dig into that a little bit further shortly. We're thinking here today about what you need to know as the patient, or if you're a caregiver or a support person. You need to be able to take these steps forwards. You need to know about diagnostic and treatment implications about fatty liver once you are motivated to look towards a more positive, more healthy future. And that's really what you need to be thinking about each day if you or a loved one has been diagnosed with fatty liver disease of some type. We've gone through a very wonderful and then disturbing evolutionary development. We've gone from, of course, our ancestors, but now we're moving into a new phase of inactivity and a diet that really ends up being toxic, especially in the setting of excess weight of some type. Let's talk through the terms and definitions. You heard the word NAFLD, non-alcoholic fatty liver disease. What's a problem with this term is that a number of individuals with fatty liver also drink alcohol, and it's hard to separate out whether it's alcohol or not. So we're really moving towards this metabolic associated fatty liver disease, which takes the word alcohol out for a moment. But then we come back in and assess alcohol, whether it's healthy, unhealthy, and contributing to the fatty liver disease as a separate process. And then we merge those together. NASH, non-alcoholic steatohepatitis, is not a virus. It's not infection. It's an inflammatory process in the liver caused by the accumulation of fat. Steatosis is a word just for fatty change. It could be across a spectrum, but usually means fat without inflammation. Then we have these new terms. Instead of saying somebody's an alcoholic, we call it alcohol-induced steatohepatitis, alcohol-associated liver disease, alcohol use disorder. This is very important because taking the word alcoholic out reduces the stigma. We need to be treating alcohol use and alcohol use disorders as medical issues, non-stigmatizing. You can have a combination of an alcohol and metabolic effect. When people are overweight or obese, we know that this reduces life expectancy. Sleep disorder, cardiovascular disease, diabetes, orthopedic problems, spine, hip, knee, ankle, gout, trouble with bladder control, infertility, gallstones, asthma, often caused by reflux disease from acid coming up into the throat and into the lungs, brain changes, including depression and anxiety. Now, these are negative messages, but I want to turn this into a positive message. When you change your lifestyle, when you change your eating behavior, when you change your exercise level, you are promoting a much healthier life. You will feel better. Your loved ones will feel better if you can help motivate them and move this as a positive effect on life prolongation, a positive effect on quality of life. One area that's underemphasized, which I think is important, when people are overweight or obese and have this inflammatory syndrome, what we call lipotoxicity or fat toxicity, it increases the risk of many different types of cancer. A little bit more information here, but what I really want to say is that a person who has fatty liver or is at risk for fatty liver typically has troubles with insulin resistance, too much insulin and too little insulin action. We can shift that by changing diet, increasing exercise, and losing weight. And there's multiple ways to reach this, which we will talk about shortly. What I like to highlight here is this 6-pillar concept. The patient wants a longer lifespan and a better quality of life, knowing about the risk of kidney injury that's directly related to the fatty liver, the risk of stroke and heart attacks, these bone and spine problems, sleep disorders, which then can affect brain functioning, the risk of cancer, the risk of progressive liver disease to cirrhosis, liver failure, or liver transplant. We can turn these negative messages into a positive message. Lose weight, you will extend your life. Increase exercise, extend your life, feel better quality of life. This is an incredible step, positive step forward. The only item on this slide I want to emphasize is in the lower right, where you see this orange triangle called lipotoxicity or fat toxicity or fat inflammation. This is an inflammatory syndrome that affects the whole body, and the person feels poorly, increasing quality of life by decreasing the toxicity, by decreasing the inflammation. Change your diet, lose weight, no alcohol. This is all going to improve your overall health and your liver health. Even moderate alcohol use is not deemed to be safe in the setting of fatty liver. There's just a list here of authors and data, but we can't find a safe level of alcohol use if you've been diagnosed with fatty liver or a loved one has been diagnosed with fatty liver. Go to a normal body weight, get the fatty liver gone. This can be rediscussed. This is a global epidemic. The US is not leading the way in one area. The Middle East is where we have the highest prevalence of this metabolic associated fatty liver disease. Diet, lack of exercise are two very important combinations here. This is associated with fat intake, calorie intake, especially a carbohydrate-driven diet. We've really learned a lot that the Mediterranean diet is excellent, really, a wonderful path forward. But if you can mix that Mediterranean diet and shift out the carbohydrates for a combination of low fat, moderate to high protein, and a vegetable-based diet is great. Fish-based diet is anti-inflammatory. Vegetarian diet is also anti-inflammatory. So we do want to reduce calories, but we want to shift our calories away from carbohydrates. This just walks through these different terms. This is a multi-step process. If it is leading to cirrhosis, this is about a 20 or 30 year process. It doesn't happen overnight. So we have time to make interventions. And you need to talk to your provider about what is your risk for liver cancer. This starts at what we call stage 3 disease in fatty liver patients. You already heard that this is a much higher prevalence in the Hispanic population, but it affects all ethnic groups. Another important ethnic group is what we call the Asia subcontinent, the India subcontinent. There is definitely a shift or a sensitivity in this population from Pakistan, India, and Bangladesh towards higher weight issues. This is often what we see is what's called lean MAFLD, or people with normal body weight. Well, it may not be normal. In the Asian population, a body mass index of 22, and you should know your BMI. BMI is calculated by how high your height, you're tall, and your weight. And it's just a ratio that can be calculated online with just a 2-step process. In this Asian population, India subcontinent population, people look like they have a normal body weight, but they have an increased abdominal girth. Their abdomen is bigger. And that abdominal fat goes to the liver and causes liver toxicity. And often they have insulin resistance that can be picked up with some simple laboratory testing. In the near future, we'll be doing genetic testing to talk about predisposition or risk of progression of fatty liver disease. Not quite ready for prime time, but I think it's really close and around the corner. What you really want to know with your provider is what is the level of fibrosis, scar tissue in the liver. That is what predicts what's going to happen in the next 5, 10 to 20 years. What's the chances of cirrhosis, liver cancer, dying of this disease, needing a transplant? The flip side is, let's go to the positive. When people have less fibrosis, they lose weight, the fibrosis is stable, the fibrosis reverses. We're watching as they extend how long they're going to live. And what's great news, you will feel better. Your loved one will feel better as they pursue this healthier lifestyle. Back to liver disease, it's number 3. When people have fatty liver disease, cardiovascular disease, heart attacks, MIs, strokes are leading cause of death. Cancer is number 2. And liver disease is number 3. These are the top 3. And these are the top 3 reasons to change your behavior, to feel better, to extend your life, decrease the risk of cardiovascular disease, cancer, and progression to cirrhosis and its complications. Fructose, this is a poison. We want to get fructose out of our diet as much as possible, unless it's in the form of natural fruits. You don't want this in soft drinks. There's fructose added to all sorts of sweets and desserts and other areas. Fructose actually goes directly to the little organelles in the liver cells and is toxic, including something called the mitochondria. These are little energy factories in the liver. Fructose is a poison in excess amounts, which is part of this current diet pattern we have in the US and in the world. There's a little bit more on genetics. I'm just going to highlight the lower right corner where it says genetic modifiers of fibrogenesis. This is what a genetic panel might look like in the near future. So be sure to discuss genetics with your provider. How do we work up patients who we think have fatty liver? Well, I think it's very important. I'm just saying every patient with diabetes needs to be worked up. Every patient who has an elevated body mass index should be worked up for fatty liver disease. We take a very good alcohol history. What other medicines are they taking? Look for too much iron. make sure they don't have an autoimmune liver disease where the immune system may be attacking the liver, a cholesterol and triglyceride profile. We're going to be measuring insulin resistance, either directly or indirectly, hemoglobin A1C, fasting blood sugar, average blood sugar. These are important, but rarely do we need to do a liver biopsy. Typically, this is done for research and for drug approval, because as of now, the FDA requires liver biopsy information in what are called phase 3 trials that could lead to a medication or a combination of medications being approved. Well, most people get an ultrasound, and the ultrasonographers, the radiologists, are very, very good about picking up the liver fat, but it's a qualitative number. It's not quantitative. It's a bright liver. The echo texture has changed. The blood vessels don't look normal. But really, we want to quantify how much fat is in the liver. We want to quantify the level of scar tissue, and we can do that in a number of different ways. This can also be picked up on CT scan or MR scan. The radiologist will read out fatty liver and give us more information about staging the liver disease. So we're going to get back to that in just a moment, but we're going to shift to treatment. So we talked about weight loss. We talked about exercise. We talked about changing diet. This decreases all these inflammatory processes that you see in the little right box. And in that big yellow star, we're going to be shifting how the body is managing insulin every day. Is it sensitive to the insulin? Can the insulin help manage the glucose and fat metabolism that we see? And of course, down at the bottom, we're seeing the progression from normal to advanced fibrosis, where you see the blue material in the right lower box. That's the scar tissue. This helps also when biopsies are done to stage the liver disease. Weight loss is key. Antioxidants. I try to get all of my patients on vitamin E, natural vitamin E, 800 international units per day. I think this is a very useful adjunct to our management. There's a lot of things we can do for diabetes now. The foundation is metformin, very safe, may have an anti-cancer effect. Then we are getting away from insulin as much as possible. We're getting away from the older drugs. Newer drugs include GLP-1 agonists, SGLT2 agonists. These are very, very important hormone-like medications that induce weight loss. They actually have very favorable effects on your heart and the blood vessels. And we have some newer medications that are called incretin and dual incretin agents that have been in the news recently that are also associated with weight loss. Weight loss helps. How this affects insulin metabolism, fat, glucose metabolism helps you lose weight, but you need to change your behavior, or a loved one, you need to help them change their behavior to maintain this healthy lifestyle for the next number of decades. Lipid-lowering agents, cholesterol agents like statins are very safe for patients with liver problems who need them. They're actually liver protective ultimately, although not a direct effect on the fatty liver. But statins are your friend unless you have a statin sensitivity, which is at less than 3% of patients. And finally, we have some newer agents such as obeticholic acid. It's a farnesenoid X receptor agonist, FXR agonist, that has finished phase 3 data. More phase 3 data came out actually just this last week on this medication. And there may be a green light someday to have this available for treating our patients directly. That's my hope. Weight loss. Look at this incredible checklist about how weight loss helps your body, helps sleep, helps reflux disease, helps orthopedic, knee, back, ankle problems, helps your lungs, helps hormonal imbalance, controlling urine output, blood pressure. It's incredible what happens as we get to a healthy body mass index of 24 for Caucasians, African Americans, Hispanic population, and 22 for Asian individuals. Body mass index is still a magic number. There have been some negative messaging about this BMI. I disagree. We need to be heading towards a healthy body mass index, healthy exercise level, healthy diet. Very important for your future. These are some foods that have what's called a low glycemic index that can help with your medication program if you're on medicines. Head towards these very healthy diet. Ketogenic diet, short term, also improves fatty liver disease. This is a hypocaloric diet, carbohydrate restriction, which we talked about before. Good data to support this for 4 to 6 weeks, and then blending back towards just, I would call, a low carb diet long term. Exercise works. Big cross-sectional study. This means a big population, almost 800 patients. People who exercised at least 3 hours a week did great. Here's some more information on decreasing how much fatty liver they have with increasing exercise. Incredible information. Optimal intensity is highlighted here. 3 hours a week, about 400 calories for each session. I call it a third, a third, a third. A third of yoga core, a third of weightlifting, and a third of aerobic activity. But during this hour, during this period, shoot for about 400 calorie burn, and that can be easily done with some simple exercise calculators or Fitbit or your exercise watch. Sleep is very important too. People need to mix a good sleep habit with this calorie restriction with increasing exercise. People feel better as they sleep more and have a better immune response, anti-inflammatory response. We talked about a number of different medications here, but what I've listed on this is more about directly changing in the upper 3 medicines, four medicines, I think, phentermine, mixture phentermine, topiramate, and naltrexone, bupropion, and also can be used with antidepressants to go to the brain and change behavior. These are licensed anti-obesity medications. The other ones that I wanted to mention here, of course, is semaglutide, which has been heavily in the news over the last few months, used originally for diabetes, but now directly indicated for weight loss. Orlistat, lower right-hand corner, this leads to malabsorption. I think that's a little out of date. We shouldn't be feeding people and then making them have malabsorption to lose weight. I like the other medications here, which really drive metabolic and central processes. The PEVN study is the study that we used about vitamin E. That's more effective than placebo for fatty liver and very safe. Pioglitazone also worked. This is an older diabetic medication. The problem with pioglitazone is that pioglitazone has a number of side effects. So I don't include pioglitazone in most of my treatment processes. I think it's out of date and we have better medications now. But there's a little controversy here. So talk to your provider about that question. So in summary, fatty liver, NASH, NAFLD, and now MAFLD, metabolic associated fatty liver disease, is a systemic inflammatory process that affects the heart, the kidneys, the brain, and of course having effect on increased cancer risk, orthopedic problems. Everybody is at risk. There are different ethnic groups with a higher risk, but this is an important assessment for all of our patients. We combine it with body mass index, hypertension, people's waist circumference, imaging of the liver. Liver enzymes are more important, at least initially, than liver function tests. Remember, AST and ALT are not LFTs. They're not liver function tests. They're liver enzymes, and they can signal the presence or risk for fatty liver disease. Stop smoking, and if you have fatty liver, stop alcohol intake until your liver health goes back to normal. A little bit more here, that weight loss of 10% is a great first level as you're heading towards a healthy body mass index. A lot of people are negative on this messaging, saying, oh, people can't lose weight, or we only want them to lose a little weight. I tend to be more idealistic about getting towards a normal or healthy body mass index where you're going to live the longest, feel the best. This is going to be fantastic for you, your family, your loved ones as you lead to a healthier body life. Statins are safe. Bariatric surgery is an option, but it's expensive and has complications. It's definitely indicated to discuss when people have a high BMI over 35 to 40, especially if they have complications. but it's a shortcut. It still requires behavior modification. Another big error, I believe, in our medical community is the lack of visits to dietitian or nutritionists. Insurance companies will pay for bariatric surgery at $15,000, but they won't pay for a $65 dietitian consult. This is totally insane. I just think it's absolutely terrible. Every patient should meet with a dietitian or nutritionist. Please strongly consider this. I use a weight loss contract or roadmap with my patients. That's downloadable at robertgish.com. As little fructose as possible. It says fructose free here, but I'm going to say low fructose, low or no red meat, vegetarian, pescatarian diet, Mediterranean diet, provided that it's low carb. And finally, plastic water bottles contain bisphenols, which are metabolic disruptors and should be removed from your diet. I want to acknowledge the GLI, the Liver Coalition, EASL. There's this EASL, EASD, NAFLD disease program. Scott Friedman, a super person in this arena. Stephen Harrison, who's been a fantastic partner over time. The NASH Forum, HepDART, AASLD, who've done a fantastic job educating providers. Now let's educate our patients. Jeff and Scott, thank you so much for having me here. Please give my greetings to Donna, our wonderful leader of GLI. The Asia Pacific Health Foundation in San Diego will be helping with the La Maestra project. La Maestra is a fantastic federal health clinic in San Diego. I'm much appreciative of the great support.